health deserves a partner, and that's where we come in. Every month, Lehigh Valley Health Networks brings together medical professionals to provide the latest information to keep you and your family healthy and safe, and all with you in mind. This month, we have vascular surgeons that will provide the latest information on vascular surgery techniques, a community leader from the American Red Cross, and a gynecologic oncologist. Joining me now is Dr. Wilson, the Chief of Surgery at Lehigh Valley Hospital Pocono, and Dr. Meyer Levy, the Vice Chief of Surgery. Thank you for joining me today.
Absolutely. Thank you.
So Dr. Wilson, would you mind sharing with us what you do here at Lehigh Valley Hospital Pocono?
Sure. I'm a vascular surgeon here, involved with endovascular and open vascular procedures, but I'm also the Chief of Surgery, which oversees the Department of Surgery, and I'm involved in the administrative direction in that department.
Thank you. And Dr. Meyer Levy, if you'd share with us what you do here.
Sure. I'm attending vascular surgeon. I'm the vice chair, and I substitute for Dr. Wilson when he's not available for his administrative duties. Otherwise, I share the tasks and opportunities to provide full vascular service at this hospital.
So not everybody may be familiar with what a vascular surgeon does. So I'll ask both of you to talk a little bit about what you do and what's involved with being a vascular surgeon.
Sure. Vascular surgery is the care of blood vessels, basically. So whether it's arterial vessels that take blood from the heart and deliver it to various places in the body, or venous blood vessels which return blood to the heart, we're involved in helping with the disease processes that affect those vessels pretty much everywhere except the heart itself. That would be the domain of a cardiologist or a cardiac surgeon. So whether it's the aorta, which is the biggest blood vessel of the body, or the peripheral blood vessels, we handle all of those.
How about your neck, right? Do you have
Sure.
vessels in your neck as well?
Absolutely. So the carotid arteries in the neck are the dominant blood flow to the brain and are a source of stroke when they get diseased. So we do get involved with hopefully preventing stroke by getting to the blockage before it can become a problem.
So I also know I have varicose veins. Can you work on them?
Sure we can, and we have a lot of different modalities to treat varicose vein disease, and not everything is a procedure. There are ways of treating varicose veins that can be very conservative and still be on the cutting edge.
Yeah, I know as summer's approaching, I start thinking about it a little bit more.
Sure.
So, Dr. Meyer Levy, we also have a wound care center in Bartonsville.
That's correct.
Do you get involved in that, and can you tell us a little bit about wound care and types of treatments?
Sure. So we were privileged enough to start the wound care center in Bartonsville, I think 4 or 5 years ago or so, and it became a very successful center because there was no wound care center at that time in the area, and it has reached a very high volume of wounds that we see on a regular basis. And these can be a variety of wounds, whether it's traumatic wounds, whether it's diabetic wounds, whether it's venous wounds, arterial wounds. So a large variety is present, and the key here is that wound care centers are very important in providing the accurate care for wound care. It's not a simple matter anymore to care for wounds, but it's a very sophisticated, scientifically researched specialty that allows wounds to be treated appropriately. So this is why we have specially trained nurses. We have a hyperbaric chamber that we can use for very stubborn wounds that require increased therapeutic involvement. And then we also do surgical debridement of wounds that need to be cleaned up. This is very important, especially for diabetics who sometimes come in with difficult wounds because due to their sensory problems they have, the neuropathy they have from the diabetes, they don't feel whether they have an injury. I've had a gentleman walk around with a thumbtack in his foot for a week in work boots because he didn't feel it.
Right.
So we always tell diabetics to examine their feet once or twice a day and always look at their soles, and or have family members look at them if they can't see them themselves. because prevention is a tremendous part of all of this.
Thank you for sharing that with us. So you used the word hyperbaric, Dr. Wilson. That's a big word. Can you talk about what a hyperbaric chamber is?
Sure. So as Dr. Meyer-Levy alluded to, we do use hyperbaric treatment in very stubborn wounds, and they're wounds that specifically have been shown that they're not getting enough oxygen to the tissue. And hyperbaric chamber allows us to, under a specified pressure with an increased oxygen in the chamber, to get oxygen dissolved into the bloodstream at a level that we can't match just sitting here in this room. So we do that in a way that for several hours at a time, Monday through Friday of the week, we're delivering a high concentration of oxygen to the tissue, and that really has been shown to help with the healing process.
Thank you. So the pandemic hit. What are you seeing in terms of patient, and we're encouraging people, if you have an emergency, come to our emergency room, it's safe. We want you to not delay care. What have you seen in your practice related to the pandemic, and then some potential implications associated with that?
Well, care has been unfortunately delayed, not because of us not being available, but really because of the fear of patients and absolutely reasonable anxiety about going to the outside and going into an institution, being exposed to other people. And it has unfortunately had consequences for patients that require immediate care, and any delay of care becomes very difficult to treat. So that has resulted in us seeing patients late, or sometimes too late, to allow for appropriate treatment or surgical procedures in that setting.
Well, I want to say thank you very much for sharing your time and expertise with us today.
Thank you.
We're very fortunate that we are able to offer this array of services to our community. So thank you very much.
You're welcome.
Thank you, Elizabeth.
I never expecting that was my heart.
It's a very technical operation. It's an open heart. We're in the Poconos, so the fact that you guys saved my wife's life, it's amazing.
In healthcare, we've shown many, many times that if you have a caring partner, it's a lot easier.
When we had the need, you guys answered the call.
The best there.
Before I became president and CEO of Lehigh Valley Health Network, I was a doctor in the ER. I've pretty much seen it all, so I understand why you may be scared to go to the hospital or see your doctor because of COVID-19. I want to assure you that at LVHN, you will safely get the care you need. We are taking every possible step to keep our ERs, hospitals, and doctors' offices clean and safe. So please, don't neglect your health. Take charge of it and know that at LVHN, you have a partner you deserve.
Joining me now is the Executive Director of the Pennsylvania chapter of the American Red Cross, Michelle Baer. Thank you for joining us, Michelle.
Thank you for having me, Elizabeth. It's great to be here.
So I'm a board member
Yes, you are.
of the Red Cross here, and I think it's been 5 years.
Yes.
So when I first joined, I was surprised to learn about everything that the Red Cross does. Can you share with us some of the activities that you're involved in?
Certainly. Whenever anyone sees my Red Cross pin, the first thing they say to me is, "Are you here to take my blood?" And
Right.
that is because we are the nation's largest blood supplier. We collect over 40% of the blood in the country through the Red Cross.
Wow.
And I always tell them, no, I'm not here for your blood. I am not a phlebotomist. But I would like to have your time and your money because I'm a humanitarian services leader. And so, of course, we have so much that we get accomplished accomplished through our volunteers. As
Right.
you said, you're a board member, which is a volunteer position. And 90% of the work that we do out in the community is driven and led by the power of our volunteers. As a matter of fact, it's so incredibly important. It's in our mission statement. So our mission is to prevent and alleviate human suffering in the face of emergencies. And we're able to do that through the power of our volunteers and the generosity of our donors. So, of course, the number one issue that occurs in the northeastern Pennsylvania area is a home fire.
Right.
And everyone knows us for our disaster relief. We are usually on the scene as soon as the first responders are gone or while they are still on the scene. And we're there just to help the family. We do that by giving them financial support with enough money to be able to secure food, clothing, lodging, medications, eyewear. And of course, we don't stop there. We always follow up with them. We have casework. Many of these folks need behavioral health, mental health. They have substance abuse issues. So the Red Cross has many, many trained caseworkers that will respond after a disaster. And of course, we try to keep all of our first responders trained through our training services. You know, so many people take Red Cross certifications when it comes to learning how to do first aid, use an AED, and potentially have the opportunity to save a life by having that training. Lifeguarding will be coming up soon. You know, we're the water park capital of the world
Right,
up here.
yes.
So we do lots of lifeguard training. We do amazing service to our armed forces. And also international services as well. So it's a very comprehensive organization. No one does what we do with the American Red Cross, on boots on the ground people, helping those families that have suffered from a home fire or a flood, hurricanes, things like that.
So I mentioned Northeast Pennsylvania,
Yes.
and we're sitting here in Monroe County, but it's much more than Monroe County, correct?
Yes. So initially we were the Pocono Mountains chapter, which was Wayne, Pike, Monroe, and Carbon. And recently we have expanded now. We are the Northeastern Pennsylvania chapter, which includes Bradford, Sullivan, Luzerne, Lackawanna, Wyoming, and the existing Pocono Mountains chapter of Wayne, Pike, Monroe, and Carbon. So we're at just about 1 million people that we serve out there in the community on an everyday basis. Not even a global pandemic can stop the American Red Cross from doing our mission work.
So speaking of a global pandemic, what types of things did you see in terms of blood collections, blood donations, at least initially, and then what are we seeing today?
So initially we had a lot of cancellations when COVID first hit, and that was because sponsors just really didn't want anybody to be in their buildings.
Sure.
So they immediately canceled, and then we really realized, like, wow, we need to put a huge push. The need for whole blood is always constant. And the schools, believe it or not, another little known fact, I learn things about the American Red Cross every day. Our high schools collect 15% of the nation's blood supply.
I did not know that.
So with the schools being closed, we really had to go out and we had to seek sponsors that would allow us to use all COVID-19 guidelines, of course, keeping people very, very safe, socially distant, wearing masks, having hand sanitizers, wiping down all of the beds. And the sponsors just came forward in our community in a major way, including the Lehigh Valley Health Network, which has been wonderful. We have been able to collect blood here for many years. The hospital collects about 500 units per year on average over the last few years. And every unit of blood we collect has the ability to help 3 patients in need. So it really is an outstanding blood collection that the hospital has had for us. So when the sponsors then stepped up, we were very much able to meet the blood demand and supply. And then we started doing the antibody testing for COVID-19. And people wanted to come and donate blood because you can find out if you may have had COVID-19 in the past by having the antibody test. So the community has just been amazing here all across the 9-county area, trying to help to meet the need for blood all around our local area. And that's that's the nice thing too, is you donate here and the blood stays here. Sometimes it'll travel a little bit out of the area if it's like a rare blood type or something that a blood bank may need. The Red Cross will supply that as well. So we just ask for one thing when you're trying to schedule a blood drive right now: just be patient.
Okay.
We are full, and we're full because our capacity is much lower based on the social distancing and the COVID-19 guidelines that we need to follow.
And I think you shared with me as a board member some really good news about our contribution in this area related to blood donation.
Absolutely. So our northeastern Pennsylvania area was #1 in blood collection for the month of January.
Congratulations.
And that, yeah, it really is. It really takes a village and a big effort of the community as well as everyone that's on staff in blood services for the Red Cross to really perform at that capacity for the volume that we were able to handle, the quality of the blood products that we were able to produce. So it's something that we're really proud, and I was very proud to share that with the board.
So if I want to make an appointment to donate whole blood or any other types of blood products, how do I go about doing that?
Couple of ways. The best thing to do is to go on redcross.org/blood, and you can search for the blood drive right there online. We have an app that you can also download to your smartphone. And the nice thing is, about 1.5 years ago, we put in what we call Rapid Pass. And you can complete a lot of the questions that we would ask you in the health history portion of your donation. You can answer all of those ahead of time. And you can tell that it's going to save you time once you get to the blood drive. And of course, you know, with COVID-19 being so prevalent, you don't want to spend a lot of time in any one place. So
Right.
having your Rapid Pass ready to go bypasses a lot of the readings and the questions that the FDA require. Or you can just call 1-800-RED-CROSS and tell them the zip code that you're looking for. And again, you know, a lot of the blood drives are booking up very quickly. So even if you have to book a month in advance, please do so, because the need for blood is constant.
So I am so thankful and appreciative of your time today and sharing
Thank
this
you.
information with us. And thanks for being our leader and all that you do.
Thank you. Thank you so much. I appreciate you asking me to be here and share a little bit of information about our amazing mission.
Before I became president and CEO of Lehigh Valley Health Network, I was a doctor in the ER. I've pretty much seen it all, so I understand why you may be scared to go to the hospital or see your doctor because of COVID-19. I want to assure you that at LVHN you will safely get the care you need. We are taking every possible step to keep our ERs, hospitals, and doctors' offices clean and safe. So please, don't neglect your health. Take charge of it and know that at LVHN you have a partner you deserve.
I never expecting that was my heart.
It's a very technical operation. It's an open heart. You know, we're in the Poconos, so the fact that you guys saved my wife's life, it's amazing.
In healthcare, we've shown many, many times that if you have a caring partner, it's a lot easier.
When we had the need, you guys answered the call.
The best there.
Joining me now is Dr. Christine Kim, a board-certified and fellowship-trained gynecologic oncologist with LVPG Gynecologic Oncology, part of the Lehigh Valley Cancer Institute, to discuss the importance of women's gynecologic health. So Dr. Kim, welcome. Thank you for being with us today.
Thank you so much for having me. I'm so glad we're able to talk about women's health today.
So tell me what you do here.
So I'm a GYN oncologist. So a gynecologic oncologist is a physician who specializes in women's cancers. And oftentimes we also see patients who might have more difficult or advanced gynecologic needs. So we're referred those patients as well.
What type of gynecologic cancers do you see?
I see patients who may have an ovarian mass, so ovarian cancers,
Okay.
endometrial cancers or uterine cancers, cervical cancers, vulvar cancers, fallopian tube cancers, and sometimes women come to see me without necessarily a definitive cancer diagnosis, but some sort of imaging finding or a pathology result that's suggestive of a cancer.
And so you're able to surgically then remove it? And do you use a robot to do that?
I can use a robot, and actually a lot of our surgery these days are becoming more minimally invasive. So
Okay.
that's really been fabulous for postoperative recovery. I think in terms of operating with a robot in a cancer setting is that we always want to make sure that it's the best thing for the woman in terms of her cancer care and her outcome. So, the robot has really transformed a lot of surgeries.
So thank you for sharing that with us. So when should women begin having gynecologic exams, and at what age should they stop having the exams?
So we would say that a woman should start having an OBGYN or a gynecologic exam as early as 13 to 15 years old.
Okay.
And certainly no later than 21 years old. Now, that doesn't mean that a young 13 or 15-year-old girl needs a pelvic exam with every visit. I think some of those initial visits probably will be more taking a good history, doing a general exam, and really talking with the gynecologist about what's going on. I would encourage women to think of it as a time when they can ask any question. There's no question that's, off limits. So anything about maybe abdominal pelvic pain, irregular menstrual periods, abnormal, discharge, questions about becoming pregnant, potentially even, vulvar itching, things like sex and sexually transmitted diseases. Now, those are all questions that gynecologists can answer, and we're comfortable doing so. So,
The types of topics that, like you said, nothing's off the table.
Correct.
People are very comfortable answering
right.
them.
And as far as when women should stop having gynecologic exams, I would say most experts would say certainly those exams should continue until the age of at least 65. Okay. I know the American College of Obstetricians and Gynecologists, as well as the Society of Gynecologic Oncologists, would recommend that the exams be done annually. I think that a lot of female cancers often at times occur later in life, so it can occur anywhere from their early to mid 60s and potentially later. So that end time, I think, is very variable. I think it would be important for someone to talk with their gynecologist about when exactly to stop. Mm-hmm. And we also know that not every visit has to have a pelvic exam, because unfortunately they don't really become, more comfortable the longer we do them, per se.
So if you do have to go see an oncologist or a gynecologic oncologist and you do need a pelvic exam, sometimes people are afraid to go or they're embarrassed to go. Yeah. What do you do or say, and our other colleagues, to help ease that embarrassment that people may feel?
I think the most important thing that we do is just communicate with the patient. We give them some privacy to get undressed. We give them an opportunity to use the bathroom if they need to. We provide a gown and or sheet to cover themselves when we're not examining certain areas. And I know that while I'm doing the exam, I'll tell my patients beforehand what area I'm going to examine, and allow a patient to cover that area up and then move on to a different area. Okay. And then it's just really assessing their comfort level. Certainly the first time a GYN exam occurs is very different from, the 30th time or 50th time that a GYN exam occurs. And whenever possible, I think my colleagues and I also try and give the patient opportunity to get dressed afterwards before further discussion is had about what's going on.
Okay, thank you. So why are regular cervical screenings, such as like a pap smear test or HPV, so important? And maybe you could just tell people what HPV stands for and what it means.
Yes. So HPV is human papillomavirus, and what we know about HPV is that I would say more than 90% of cervical cancers are associated with persistent HPV infection. So there are certain types of HPV. There are many different types, but particular ones are considered high risk for cervical cancer. What we also know is that, women, by the time they become sexually active, actually more than 80% of women are exposed to HPV, that's sort of a natural part of becoming sexually active. But we also know that most of those women are able to clear the infection on their own without any sort of gynecologic or gynecologic oncology intervention. And really, since the 1950s, when the pap smear became available, what we've seen here in the US is that the rates of cervical cancer have gone down by more than 50%. So a pap smear screening test with HPV co-testing, we would say, done at the same time, has allowed us to detect precancerous lesions. And so what we know about cervical cancer is that if we can detect it early, or if we detect high-risk kinds of precancerous changes early, that we can treat it, and it may not progress, and it's curable.
So early detection is the key.
Definitely the key.
Okay.
And actually, I would say nowadays we're also very fortunate to live in a world where we have access to HPV vaccination. So my big plug, oftentimes I'm seeing older patients per se, but I talk to them maybe about their daughters or their granddaughters, and young women at the age as young as 9 years old, but oftentimes more like 11, 12 years old, as well as boys, have an opportunity to receive HPV vaccination against some of these high-risk types.
So you do encourage the
I do.
Good.
I really do.
Well, thank you very much for sharing your time and expertise with us, and thank you for all that you do for our patients.
Thanks so much for having me.
Thank you for joining us. It's been such a pleasure to speak with our Lehigh Valley Health Network providers. We know that this is a scary time for people, and what I encourage you to do is don't delay care. Lehigh Valley Hospital Pocono is the partner that you can trust to keep you healthy and safe.